Hello, my name is Dr. Reed Tuckson, a member of the Black Coalition for Health, and we want to welcome you to this special program, Sickle Cell, More Than Growing Pains. I have a special interest in this disease as earlier in my career, I organized efforts to improve the quality of care and the quality of life for people living with sickle cell disease in the city of Philadelphia. This show is timely given that September is National Sickle Cell Awareness Month, a time to highlight how this genetic disease impacts over 100,000 people, most of whom are of African descent. And it also highlights the importance of working together as a community to donate blood and holistically support our young students with sickle cell trait and who have sickle cell disease. I do want to acknowledge that our conversation is brought to us by the American Red Cross and blackdoctor.org. To help us to explore the impact of sickle cell trait and sickle cell disease and its effect on youth and young adults, and how caregivers, advocates, and community partners can help, I'm excited to introduce our four panelists, beginning with Dr. Kim Smith-Whitley. She is the site head and advisory of scientific and clinical affairs at Pfizer, where she leads the research, development, and global medical affairs teams. She's formerly the executive vice president and head of research and development at Global Blood Therapeutics. Previously, she served as the clinical director of hematology and the director of comprehensive sickle cell center at Children's Hospital of Philadelphia. Dr. Tamia Austin, a behavioral scientist, health educator, and researcher. She is the executive director of the As One Foundation that was established with a mission to help empower youth to unlock and unleash their full potential through athletics, education, and spiritual enrichment. Since the foundation was also established to honor the memory of the founder's late brother who died of dehydration complicated by sickle cell trait, Dr. Austin has authored a program called Operation Hydration to bring awareness to sickle cell trait and promote hydration as a matter of prevention of its adverse health consequences, such as what is called exertional sickling, which we will come to understand as the program evolves. Dr. Laventrice S. Ridgway, Assistant Dean of Student Affairs for the University of South Alabama's Whittington College of Medicine. She herself lives with sickle cell disease and is well acquainted with how this chronic condition can influence one's life. As such, Dr. Ridgway has long advocated for accessibility and disability services. And finally, we are very pleased to welcome Dr. Yvette Marie Miller, Executive Medical Director, Officer for the American Red Cross Donor and Client Support Center in Charlotte, North Carolina. There, she oversees donor eligibility, product management, and donor management for 36 Red Cross Blood Services regions. Her areas of interest include promoting diversity in the blood supply, increasing donor recruitment and retention in the Black community to support the transfusion needs of patients with sickle cell disease, and leading conversations on structural racism and its impact on the social determinants of health and healthcare delivery in underserved communities. Let me begin with Dr. Miller and help us to understand.
The screen was frozen.
When I was speaking?
Yes, when you were speaking.
Oh, I'm sorry. It froze just now?
It did. Yeah, it's okay now, but it froze.
Well,
before.
listen, let me reintroduce you. I mean, we asked that question because it is very important that we set this up well. And so what we really want to begin to understand as a ground setting, what is this disease called sickle cell disease, and what is the difference between that and the trait?
Sickle cell disease is the most common inherited blood disease in this country. And as you already mentioned, affects about 100,000 people, the great majority of whom are African American of African descent. In terms of the manifestation of the disease, normal red blood cells are soft and round, but individuals with sickle cell disease their red blood cells are fragile and are crescent shaped, and they actually clump together and block blood vessels, which prevents the tissues from receiving oxygenation. And that leads to one of the primary manifestations of sickle cell disease, which is the pain crisis.
So
Now,
let me make sure I think this is, you've given a very good example of that. So what you're saying is that these cells change shape, and in doing that, they kind of block the blood vessel and block the blood flow. Is that what you're saying?
yes, it blocks the blood flow to the tissues, and that leads to the complications. And the complication that most people are familiar with is the sickle cell pain crisis. Individuals that have sickle cell trait, however, they generally do not have symptoms, but under certain circumstances, which we will talk about later on as we progress through this conversation, may have some symptoms associated with sickle cell disease. But more often than not, people with sickle cell trait do not have symptoms of sickle cell disease.
And just to give our audience a sense of the severity that sickle cell can bring, because a lot of times we often hear the term, we understand that people have pain, but I don't think many people understand some of the real consequences to the body. What can you tell us that is a major concern to what sickle cell does to the body?
Mm-hmm. So some of the most serious consequences of sickle cell disease is stroke. And for many patients diagnosed with sickle cell disease, they can have their very first stroke at 6 months of age. And that's when the body converts from what we call fetal or baby hemoglobin to adult hemoglobin. And once they convert to that adult hemoglobin, the sickle hemoglobin and the sickle cells are the only cells that their body produces. So a stroke can be a primary condition that can occur with individuals with sickle cell disease in infancy. And that's a very serious complication. It can affect the heart, the lungs, can lead to chronic renal failure, can lead to loss of eyesight, and can also lead to loss of limbs because of sores that occur on the feet and on the ankles that never heal, and it can lead to amputations.
Really, Dr. Miller, I think that what you are really emphasizing for us is number one, all of us in our community need to know about this disease, but I think we also have to have the sense of empathy and caring about our brothers and sisters, and especially our young brothers and sisters who are going through what really, and the way you describe it, is that this can be very, very, very painful and have serious complications. As a result, I know that you and your leadership role at the Red Cross are especially emphasizing the need to have a diverse blood supply. Why is that so important in this case?
In this country, only about 3% of blood is donated by people of African descent. Since sickle cell disease is an inherited disease, and we inherit our blood types, from our parents, in some cases, patients with sickle cell disease will need a closely matched unit of blood, and the greater likelihood of finding that compatible unit of blood will be from someone that is of African descent or that is Black. And that's why it is important for us to increase the diversity of the blood supply and encourage and support and keep the awareness for the Black community, and increase the awareness for the Black community of the importance of blood donation to support this patient population. But also, we need diversity in the blood supply, because African Americans, the most common blood type in this country is blood type O. And African Americans, 50% of the Black population is blood type O. So even if we weren't having this conversation about sickle cell disease, we would still be having this conversation about needing people of African descent to donate just to meet the general population blood needs.
And just quickly, would you help us to understand misconceptions about why are they worried about? What do people fear, or what causes us in our community to be hesitant to donate blood?
Well, one of the first things that causes people in the Black community to be hesitant is because of mistrust, and mistrust of the medical system. And that is sort of boils over and affects the thinking around the safety of donating blood. And so part of our work in the American Red Cross and through our sickle cell initiatives and our Joined by Blood campaign, we are working with our partners such as the 100 Black Men, the Divine Nine, all the sororities and fraternities are part of the Panhellenic Council, and other community-based organizations to increase awareness about what sickle cell disease is and how blood donation is one of the primary treatments for sickle cell disease. And in some cases, that most compatible unit will be found and identified from a donor that is African American or Black.
And you have finally, my last question for you at this point in the show, but I'm very interested in this special initiative that you are talking about.
So the special initiative is known as Joined by Blood. It's an initiative that we actually began in 2021, and the Joined by Blood is our latest activation. And again, it's an intense awareness campaign that we are working with our partners to help get the word out and encourage and support and make the connection with the Black community between why is it important for the Black community to donate blood and the connection with sickle cell disease, and that blood transfusion is one of the primary treatments for sickle cell disease. So making that connection is incredibly important and one of the important pieces of our platform as we do this awareness campaign.
Thank you so much. Dr. Smith-Whitley, in addition to the challenges faced by adults and children with sickle cell disease, adolescents have special challenges to overcome. Can you describe some of those issues?
So Dr. Tuckson, I'm glad you bring up this topic of the challenges of adolescents or emerging adults living with sickle cell disease. Just as individuals with sickle cell disease are graduating from high school, thinking about going into the workforce, thinking about going to college, they also become responsible for their own health care. And at that time, they are really challenged by increasing complications associated with sickle cell disease. Dr. Miller mentioned the pain episodes associated with sickle cell, as well as the end organ damage, but also the physical stigma associated with sickle cell disease might be the yellowing of the eyes or jaundice, and that's because of the fragility or the breakdown of the red blood cells. And the other issue is delayed puberty. And so individuals with sickle cell disease are further stigmatized by this lack of understanding that the reason that they may have this pubertal delay and the reason that they may have this yellowing of the eyes is because of their sickle cell. And so unfortunately, we have to deal with self-advocacy and helping to address issues around bullying, depression, and anxiety in these situations.
I think we all have heard the term that Black lives matter. And I believe that they do. But if they do, they have to matter to us first. And it would just seem to me almost incomprehensible that our community would stand back and watch our own children suffering from disease being treated inappropriately. Those lives have to matter. And I hope that everyone watching today will make it their personal business, whether it's this issue or anything else, that you see bullying of our children. This is a community responsibility. Don't you think, Dr. Smith-Whitley?
Absolutely. And the community needs to understand that living with sickle cell disease is a challenge in and of itself, and it's an inherited condition, but it's also a condition that has been characterized by health inequities. The research done in the sickle cell space had to be advocated for in the 70s. I don't have to tell you this, Dr. Tuckson, and we didn't even have national newborn screening until the 90s. And it wasn't until really 1995 that we had a disease modifying therapy for sickle cell disease. So you're right, it is a community issue, and we need to address the disparities associated with sickle cell disease and increase the awareness.
So what age, if I'm the parent of a child dealing with these challenges, at what age should we encourage our child to tell their teachers or their parents that they are hurting as a result of pain?
So I'm really glad you bring this up, Dr. Tuckson, because I think that young people living with sickle cell disease are trying so hard to be like their peers. And so they may not want to have a discussion with their parents or their teachers about the pain that they're experiencing, because they don't want to be different from their peers. So one of the things that we have to do is to encourage young people to speak up about their pain, and also teach the caregivers and the adults how to let individuals do what they would want to do if they were not living with sickle cell disease, and then set their own limits. So really opening up the conversation early to say, this is a difference that we can manage and that you can then adjust and get back into the swing of things with your peers, as long as we have an open, transparent understanding that if you're suffering, that you're going to let us know.
So it's okay to say, I'm hurting. It's fine. In fact, we want you to do that. That strength is admitting when we are in pain and seeking help. That's what I think we had to really drive home for all of us. When we are in pain, seeking help is the sign of an intelligent person who responds to that. One quick other question. We talked about the adolescents and young kids. What about the kids that are going to college? Now, that's a whole nother set of challenges.
It is another set of challenges. And as you know, young people going to college are learning how to do so many things on their own. But then they're going to also have to understand how to best take care of their chronic condition as they're going into this college setting. So it's very important that individuals living with sickle cell disease contact their medical team to let them know that they're going to college, and then that medical team needs to help support that individual by a couple of things. One, helping them understand what special accommodations need to be at that college campus or in that room. And two, also giving them everything they need to stay healthy in that situation, making sure that they have their medications, making sure that they know how to get to a hospital if they're having an unpredictable pain episode. So those things are so vital to empowering young adults to be able to manage their own health care.
I really love this advice. I'm sure that there are people out here in the audience now who have rising seniors who are about to go to college. And your advice is, terrific in a lot of ways, not only just for patients with sickle cell disease, but when you're taking and preparing your child to pick what college do I want to go to. Academics, of course, most important, not the partying. That's not as important. But clearly being able to find out what services, the health services they have, and also the quality of the hospital that that your child would be going to if they were suffering a crisis. These are things that would not be in the typical handbook, but we're telling you today, so you write that down. I know somebody who understands these issues very well, and let me bring my brother, Dr. Ridgway, in. He is our sickle cell warrior. And you've lived these challenges, Dr. Ridgway. How are you hearing this conversation?
Thank you, Dr. Tuckson, for bringing that up. As I hear my fellow panelists talk about some of these recommendations, I think back to my own experience, and I'm like, I did that exact same thing. I experienced some of those same feelings, being in childhood and wanting to be a part of what everybody else was doing, but also, having a grandmother that sheltered me and, really did not want me to do things that would incite a crisis or an episode, limited some of the things that I was able to do. Being involved with my treatment team and understanding that they could give me the recommendations and the guidance that I need as I went throughout college, connect me to different resources, and even in my professional life, as I transitioned to different roles or whatnot in different cities and different states, supporting me to get connected with different resources in those areas. It's like, okay, people are out here really doing the work, and I really see myself in some of what my panelists have mentioned tonight.
Now, would you, as you look back on growing up with this, would you keep this disease secret? Is this something that you felt that you could not share with your peers, or did you openly talk about it?
Good question. So I would say, if you ask me that right now, in who I am now, and where I am at with my identity now, I would say yes, it's something that I openly talk about for different reasons. One of those reasons is when I go into a crisis, I need someone who is strong enough to understand and be able to recognize what's going on. I don't need someone around that is going to, kind of break down and lose it because I'm doing the same thing. So, I don't need to care for you while I'm caring for myself. But now, if you had to ask me that several years ago during my childhood and adolescence, I would tell you, that that's not something that I readily shared with people because just naturally I am a private person. I'm very big on intimate and close relationships. I don't have everybody in my circle. I keep a tight knit, close circle. And so, I'm very much one of those people that it's not a secret. It's just not your information. It's just not for you to know. And so, back then I probably would not have shared it. I even remember one situation where I started dating, or I say dating or whatever. When you're 12 years old, you don't know what dating is. Where I was really interested in this young woman, and I went through the mental work to figure out if this is something that I should share with her now, because I don't want her to look at me differently. I don't want her to feel like this is contagious or, something like that. And so, again, I was very private at that time with that in many things in my life. And even now, I'm still private, but this part of my identity is something that I definitely openly share.
So just do me, I mentioned earlier that I did a lot of my work when I was very early in my medical career at the hospital of the University of Pennsylvania. And I was distressed when I got there to see the way in which sickle cell patients were treated or mistreated, how they would be in pain and would have to beg to get treatment, to convince someone that they should have their pain relieved, as opposed to them being there to receive narcotics illicitly. There was just a lot of other social elements. And so we created what we call the Sickle Cell Club that brought in all the patients together regularly and brought in the parents. And so I want you to look in the camera and talk to that adolescent boy or girl that's going through this in adolescence, and what is your advice to them that will give them the best chance not only to be successful academically, but also in terms of enjoying the full range of their life? Tell them what you think they need to know.
I would say, know that whatever you're going through is real. You can't let someone take your experience away from you. Whatever your experience is, that's your experience. I would also say definitely understand that this particular part of who you are does not define, does not dictate. It may influence, it may give you something to think about when you're developing your plans, when you're determining, where you want to go in terms of college, things like that, the resources that you connect with, but it does not dictate your overall outcome. I can say from my personal experience, that was something that I had internalized during my adolescent, my teen years or whatnot, is that, with sickle cell, that was going to be it. As I matriculated to college, I really became to understand that I can move my life the way that I want to. It may take a little planning. It may take a little, connecting with the Student Disability Services Office, connecting with the Dean of Students while I was in college, what have you. But I can do what I want to do. And whatever I put my sights on, I can achieve that. And so that's how I was able to, lead the office of the Disability Services Office. That's how I was able to lead in the Student Affairs Department at FSU, Florida State University. And that's how I'm now able to be at the College of Medicine at the University of South Alabama, is because I understand that I have so much more to offer than just sickle cell. That's just another part of my identity. And so that's what I will leave with anyone who, probably has the same experience as me, is that that's just another part of your identity, and whatever else, it intersects with.
One of the great things about these blackdoctor.org shows is that they are archived and you can go back and the audience can revisit it. And I would really hope that every parent who is watching this, if your children are not watching, have them watch the replay and understand that it is possible. In fact, it is commonplace for people with sickle cell disease to become very successful academically and wind up being in the dean's office at a prestigious American university, as you have done. And I think it is important that folks know that there is no ceiling on your ability to achieve simply because you are going through these challenges, as serious as they are, and we must take those challenges seriously. But there is no ceiling on your ability to be the person that you want to be. And I would hope and imagine, by the way, that you might have one last comment around how do you help young people who may be depressed, who are just sick and tired, as they say, of being sick and tired, are tired of going through this. And that can be, depression can accompany this. What did you have to work through any of that? And do you have any guidance?
Absolutely. Yeah, that is definitely one of the things that I had to work through as a kid, because again, when you're a teenager, you want to be a part of everything. You want to do what everyone else is doing. And even as a child, I didn't understand why I couldn't. Like my grandmother, she was the one that took care of me and reared me. And she, again, sheltered me from a lot of stuff and kept me from a lot of things. So football, sports and things like that was not one of the things that I did. But I ultimately ended up understanding that I have a brain. I can do the work mentally or whatnot. But again, all of that to say that having those depressive symptoms is something that I did go through. And I think what I ultimately understood was that this is it. This is a reality. This is something that I'm going to always have to think about. But again, it's not something that is going to limit me. I think, ultimately I had to realize that I was doing the negative self-talk. I was telling myself those things, but, reality was something different. And ultimately I had to do the work to realize that.
Wow. That level of personal accountability is a great lesson. And again, it just seems so instructive to me tonight that so many of the comments that we're making about sickle cell disease apply to all of us as how we live our lives, and especially for our children. And I think that notion of not allowing yourself to be victim, not allowing yourself to say, I can't do because I have this significant challenge, but in fact, using that as an inspiration to kind of go forward. I think you are a great role model, my brother, and I really, really am glad that you're on this show. Dr. Austin, I must say that I was very saddened to learn that your family experienced the tragedy of losing your brother who lived with sickle cell trait. Can you help? We talked earlier about the difference between sickle cell disease and sickle cell trait, but what is it about the trait that caused your brother to suffer as he did?
So Devon Darling is not my blood brother, but certainly I have grown to love him as the leader of this organization that was founded by his identical twin brother, DeVar Darling, who died of trade exertion at Florida State University during college workouts. He was coached the first thing is he learned about sickle cell trait when he went to participate as an athlete at Florida State University. And that experience was, you have sickle cell trait, you have nothing to worry about, you'll live a normal life, just avoid the 25% chance of birthing a child with sickle cell disease by not procreating with another person with sickle cell trait. And they were sent along their way. The education that the As One Foundation provides that educates trait warriors to be aware of the top risk factors of sickle cell trait: exertion, elevation, dehydration. And when it comes to that exertion, to warm up, drink up, rest up. That is you just can't go from rest to exertion quickly. You need to, work your way up. And
give me those three again. I like those three.
Warm up, drink up, rest up.
All right.
And the drink up is obviously hydration, and we certainly advocate for hydration before, during, and after physical activity, but also to consume at least half your body weight in ounces of water per day to avoid dehydration. This, of course, is applicable to all of us, but certainly for those that have the sickle cell disease and sickle cell trait that needs that water to help with good blood flow and all of the great things that water does for our bodies. And then the final thing is rest up. those recovery breaks. And those recovery breaks, Devon was not afforded in a fanatical football conditioning workout, which is prolonged, strenuous activity. Some of them are called gassers and suicides. Why would a workout be called a suicide? Well, you're thinking about the young athlete, the young person that has so much to prove, wants to prove how far he or she can go, how hard he or she can go, and then they're being told by coaching, your body is amazing. You'll pass out before you die, and if you pass out, we have people that'll, take care of you. And it's the fourth quarter, and this is the fourth down against Miami. Are you going to go hard, or are you going to go get water? So that association of water with weakness, or water with substandard qualification, that's got to go. And that's especially important because of the exertion top risk factor. Sickle cell trait is classified as the top killer of collegiate athletes. And of course, the African American, or the athlete of African descent, is overrepresented in those numbers. This education, these words that I'm saying, had they been heard and adhered to by Devon's coaches, even had his athletic trainer been listened to, maybe he would be here. There are so many other complications that have been associated with sickle cell trait in the literature, such as clotting, we're called more than growing. The title of our presentation today is More Than Growing Pains. Not at 48. I've had a sickle cell trait warrior, as we call her, report to me that she thought she was still having growing pains. Not at 48.
Yeah.
So
this is important. So let's make sure that we're very clear, though, on this point about whether or not young children with sickle cell trait, should they participate in strenuous athletics, what is the message? Should we actually allow our children with the trait to be participating in strenuous physical activity?
Absolutely. They are the characterization as nothing to worry about is not far off, but it's nothing to worry about if you warm up, drink up, rest up. You have to take precautions. You have to warm up. You have to be hydrated, and you have to take recovery breaks. That's what taking a knee, that's the benefit of taking a knee, or, walking with your hands on your hips, or clearing your lungs with your hands above your head. That is the simple formula that can keep adjusting for population or what have you. There's a very loose statistic that says about 18% of professional athletes in the United States are also trait warriors. So no, absolutely they can play. Absolutely they can march in marching band. Absolutely they can pledge a sorority or fraternity. Absolutely they can be a dancer. They just need to take the precautions to take care of themselves, because definitely in those rare instances of extreme exertion, or threats to their elevation, whether that's mountain climbing or flying, where they experience the splenic infarction, or deep sea diving, any threat to oxygen can be problematic for our trait warriors. And there is definitely a correlation that is now recently in the research about the exertion and the rare but often fatal, because of the late stage diagnosis, of renal medullary carcinoma, which is a kidney cancer that affects statistically only people living with sickle cell trait. Exertion is now correlated with that RMC, and so those precautions are priceless for our trait warriors.
It would seem then that it would be important for us to know whether we have the trait or not. How does that work? I mean, what is your guidance about how we discover this?
Know your status, get tested, and get tested with the sensitive electrophoresis, the hemoglobin electrophoresis, because
So the electrophoresis is a special kind of lab test that it enables us to separate out and understand the various components of the cells in the bloodstream. But please continue.
Yes, it tells us your genotype, and it tells you the percentage of the abnormal hemoglobin in your blood, which it can be an indicator of symptoms when a trait warrior is symptomatic. The hemoglobin electrophoresis will tell you and so I like to advocate that even though this is a condition that where people of African descent are overrepresented, skin color is not the principle of exclusion that we want to play, because sickle cell disease, sickle cell trait can affect people of various ethnicities, including Latin, Asian, Indian, Italian, Irish, Greek, and Turkish descent. So anybody could have it. I know plenty of people that identify as white or Caucasian with blue eyes and blonde hair that have sickle cell disease and sickle cell trait. So
we don't have a lot of time to get into this particular topic, but let's just ask it very quickly, because you mentioned it very quickly, and that is the notion of people finding an appropriate mate to have children. What's the issue here, and what do we kind of need to know about people with this trait and their choices around producing a child?
Because people with trait make people with disease, and every offspring of our disease warriors statistically will be a trait warrior. So it's all in the family. So procreating with another trait warrior, there is a 25% chance of birthing a child with sickle cell disease. I'm not telling you don't have a baby with sickle cell disease. I am advocating for you to know and have an informed experience about childbirth, and vice versa. To all of our warriors, every one of their offspring will at least be a sickle cell trait warrior, because your offspring gets half of your DNA. That's the message to know your status.
I would imagine if people wanted more advice on that, they can reach out to the As One Foundation and of course, obviously talk to your physician. But the one thing that I will say from my experience working with patients with sickle cell disease, they would rather be here than not.
Absolutely.
And that we have to really respect the various forms of the human condition. Some of us have challenges like that. Others are born with other challenges. At the end of the day, we're humans working our way through life, and we respect and love life in every manifestation. Let me move now to this special initiative joined by Blood Initiative. And Dr. Miller, help us to understand, in addition to the work that we've talked about in preventing, is there a treatment?
Yes, there is a treatment for sickle cell disease. As as already mentioned, one of the primary treatments is blood transfusion, but there's also medical therapy. In 1998, I think it was the first drug that was approved by the FDA, hydroxyurea, to treat sickle cell disease. And that drug is actually a chemotherapeutic drug who has a positive side effect that it increases a certain type of hemoglobin that helps in the treatment of sickle cell disease. And in 2017, 3 other drugs were approved. Between 2017 and 2019, 3 other drugs were approved to treat sickle cell disease. Now, in terms of cure, currently the only cure for sickle cell disease is a bone marrow transplant or stem cell transplant. But not every patient is a candidate for a stem cell transplant, but also in terms of finding an unmatched donor, only about 25% of individuals will be able to find an unmatched donor. So we look to family members or related sibling or family member for a bone marrow or stem cell donor. So those are the primary. Go ahead.
No, I like that. I mean, and again, what your point seems to emphasize again is we, as the Black community, are all in this together. We need to be donating, whether it's bone marrow and being accessible and willing to participate in that, or in blood donations as well. I've been following and trying to keep up with the scientific advances, Dr. Miller, in this disease. And one of the things that we as African Americans have a legitimate reason to complain about oftentimes is that we don't seem to get the priority for some of the scientific advances, and that we sort of, and maybe a lot of us don't participate in clinical research enough to help bring those scientific advances forward. in this disease, I see a lot of activity, and I think you described that. Are you comfortable with the energy and the attention that the scientific research community is giving us so that we can develop these prevention and treatment strategies?
Certainly, in the last, I would say, certainly 10 years, but mostly in the last 5 years, there's been a tremendous amount of research in relationship to gene editing. And again, there's a lot of conversation around that, as a lot of fear and mistrust with the Black community in terms of that word gene editing. There's a lot of conversations in relationship to getting, because some of that technology was used when we were discussing COVID-19. So there's a lot of education that has to occur. But what has been shown is that those gene editing research protocols, and they're still research protocols because they have not been approved by the FDA for treatment of patients, has shown some significant promise in terms of finding and not necessarily, we don't necessarily call it a cure, but providing treatment for individuals with sickle cell disease so that they no longer have symptoms and no longer have complications of sickle cell disease. So there's some tremendous, excellent research going on now in terms of gene editing that can absolutely help prevent sickle cell disease. And that's the next thing that's really on the horizon.
Well, I think that's very promising, but it also opens up a can of worms, as you've said, because there will be a lot of people that will be very anxious about this term, gene editing. And do any of our other panelists have any ideas about how we might be able to talk about these kinds of more sophisticated issues, like dealing with our genes themselves? And how can we help the Black community understand that this might actually be in our best interests?
So, Dr. Tuckson, I'm glad you raised this issue. I think that it has to be a conversation that really individuals understand that there are different types of genes that we have, and that actually there's sometimes a misconception that the gene therapy is going to change that individual's ability to pass on the sickle gene, which it will not do. The genes that are altered are the genes in the cells that live in the bone marrow. And so I think that that distinction is really important when talking about these cellular therapies. But again, I think the conversations have to be broad and transparent, and include all members of the community. Part of the problem is that we have conversations in absence of the community that needs to hear the message. And so really including the community early is the best way, I think, to address the issues around any new therapies.
Oh, that's an excellent point. And I would imagine also, Dr. Ridgway, that you would, well, I don't know, I don't want to put words in your mouth. Would you support that, think that it's important that we all reach out to our Congressional Black Caucus members and make sure that they are attentive to the resources being devoted to research on this disease?
Absolutely. I think I would definitely support that. I think that is something that needs to happen. Our power is in our vote. Our power is in our voice. Our power is in how we choose our legislation and how we choose our leaders. And so I think, we definitely need to be reaching out to make sure that they understand that this is what we want. We want more of a push toward, a focus on this type of science and this type of research.
Great. And back to you, Dr. Miller. And I want to make sure that we get a full picture of this marvelous program that you at the Red Cross are leading, this Joined by Blood initiative. Just let's make sure we understand the full spectrum of what you all are trying to do and achieve.
Mm-hmm. So the full spectrum of what we're trying to accomplish, again, is awareness in the Black community about the importance of knowing your sickle cell trait status. That's one of the hallmarks of this program, is that we have screened over 140,000 individuals for sickle cell trait. And it's already been mentioned multiple times during this presentation, is that knowing your sickle cell trait status is critical. It has multiple implications throughout your life in relationship to your health, as a relationship to decisions around procreation and having children. So again, this is not a judgment call about decisions that you should make, but having the information about your sickle cell trait status is critical, and having those conversations are absolutely critical.
So let's
So
again
that's
make sure, Dr. Smith Whitley and Dr. Austin, when do we get tested? How do we know? What's that process like? Who do we go to? Is it a part of our normal physical exam, or do I need to make a special appointment with a special doctor? How does it work?
Well, I can start, and then Dr. Austin, please contribute as well. One of the things that I think is so important, Dr. Tuckson, and you were on the front line when this was coming into play, is newborn screening for sickle cell disease.
I think you just mentioned that I'm very old. Thank you.
No, absolutely not. Especially since I was on the scene then too, and then I would be putting myself in that category as well. But no, since really when 1992, we had almost targeted newborn screening. It wasn't universal. Unfortunately, early on, we were just screening babies of Black and Brown communities. Now everyone is tested for sickle cell disease and sickle cell trait at birth. And that's been going on for at least 2 decades universally in the United States. However, that's not globally. So individuals that are coming to the United States, they need to know their sickle cell status if they didn't have that newborn screening when they were born. And then, of course, anyone who is older also needs to be tested. The other problem I really want to emphasize, though, is that just like Dr. Austin mentioned, many individuals who are born with sickle cell trait, their parents may have been told that this is really not a concern. And it is a concern. You need to know your sickle cell status because you need to know that there are certain complications with living with sickle cell trait, as Dr. Austin has talked about. You need to understand the genetic implications, but you also need to have the power of your information. And so I encourage caregivers to write down the sickle cell trait status in their vaccination records so that that information is discussed and passed on to that child so that when they're going to college, there's a discussion about their trait status. When they're going into the workforce, there's a discussion about their trait status. So this is very important. The other thing I will just emphasize is that individuals with sickle cell disease can have a number of different types of sickle cell disease. Mm-hmm. And there are instances where you don't have sickle cell trait, but you can have a child born with sickle cell disease. And how does that happen? Well, because you have the trait of another hemoglobin variant, C trait, beta thalassemia trait. So it's very important that an individual who thinks that they may not have the opportunity to have a conversation about having a child with sickle cell disease because they don't have trait, please don't be fooled. You need to be educated and you need to have a hemoglobin electrophoresis because that test will tell you if you have these other hemoglobin variants. And that's a very important distinction.
So, Dr. Austin, let me just kind of go back on this. So one of the hallmarks of good pediatric practice is the well child visit and the regular routine visits that a family has with the pediatrician. Is this the moment where we need to ensure that every parent of an African-American child asks specifically of their pediatrician, what were the results and what do I need to know? And do we need to engage in more intense testing with an electrophoresis? How does that, is that one of the tasks of the well child visit?
That's definitely one. Everything that Dr. Smith Whitley said times 100,000. The discussion, because that, the newborn screening letter has just disarmed a new patient. Oh yeah, my child was born with sickle cell trait, but there's nothing to worry about. And then there's no more discussion. So that universal education about sickle cell trait and about procreation and all of that kind of just, it's not prioritized, and that letter goes in a drawer. And as Dr. Smith Whitley said, what about our older citizens or people, in the immigrant population that have entered the country or dealing with, taboo and not discussing it. I can remember, I've certainly have been told that the trait screening used to be a part of the marriage license process. I'm just all about people knowing the status, but also discussing, being empowered by the information. I believe that there are certainly many more opportunities for the conversation. Of course, we also have the mandate for the trait screening when they go to play NCAA sports, the National Collegiate Athletic Association mandate, but there are other collegiate leagues that don't require it. High schools don't require it. All high schools, there's no high school mandate. Certainly, and it's not just reserved for people that are athletes. Like I said, dancers, marching band. So yes, to answer your question, that well child visit is definitely one opportunity, but universal education, we're going to get a big education about what universal education is as the clock strikes October 1 and the world turns pink. Everybody's not going to have breast cancer. Everyone's not going to develop it, but we're all going to be educated about it. Good. And I certainly appreciate blackdoctor.org taking this opportunity to raise awareness, to help us raise awareness about something that 4 million people are affected by in the United States, and most of them are not aware of the implications.
And let's just make sure that we, again, nail this issue. It is important to know the information, but knowing the information does not rule you out from having a full life, from being able to exercise, participate in sports, in the band. In other words, ignorance is not you don't get a free pass simply because I didn't know.
Right.
And that you don't need to be fearful, but that because you know, somehow or another your life is truncated. That's not what we're talking about here. And so I think we just want to be very clear. We're almost at the end of the time, but Dr. Austin, we've seen the name of your foundation under you the whole show. We got to give you a moment to just give us a quick 411. What is your foundation?
So our mission is to empower families globally, delivering life-saving sickle cell education. Again, this education is what we believe could have saved Devon's life. And it is dedicated to his memory and now to the memory of their mother, who also died as a trait warrior in 2020 on the same day that Kobe Bryant died. Empowerment, education, the point that you're driving home is why we exist.
Great. Well, now, as we close out the show, as we always do, we want to give each of our guests 20 seconds in the lightning round to say either something, double down on something you've already said, or say something that you wish you had said and you don't want to leave this program not having said. So 20 seconds, and we're going to begin with Dr. Smith Whitley. We'll go then to Dr. Ridgway, then to Dr. Austin, and then to closing out with our Red Cross expert, Dr. Miller.
My 20 seconds is spent to give you a challenge. Educate others. You now know more about sickle cell disease and what you can do to improve the lives of those living with sickle cell. Know your trait status, increase awareness, stamp out stigma, and really advocate for health equity in those living with sickle cell disease. And please donate blood.
I'll take my 20 seconds to really just reiterate something that my colleague, Dr. Whitley, mentioned earlier. And I'll sum it up in 3 words. And this is for you parents. This is really for you parents. Educate, understand, and breathe. I say educate because you need to really understand your child's sickle cell type, the ins and outs of it. Understand that it is not the end of the world. They can do different things. All you need to do is make sure you know the limits, you know what they can and cannot do. And then breathe. Take a moment, let them get into whatever they need to get into, let them experience their life, and a little bit of let go. So just take a minute, take a step back and breathe, because it's going to be okay.
20 seconds.
Get tested, know your status. And trait warriors can donate blood. That's a myth out there. Trait warriors, people with trait, can donate blood. So donate blood.
That was important to get in. Thank you. And our last word from our guest, our special host.
Please roll up your sleeves and donate blood. And in the process, you can certainly learn your sickle cell trait status. And you can do that by visiting our website, joinedbyblood.org, calling 1-800-RED-CROSS, or downloading the Red Cross Blood Donor app, and you can make your appointment in the Blood Donor app. So once you make that appointment, the second most important piece is keeping that appointment. So thank you.
Very important. Well, thank you, Dr. Austin, Miller, Ridgway, and Smith Whitley, for all that you are doing to help raise awareness and support the sickle cell community. As we shared tonight, students with sickle cell disease often face unique challenges on top of missing school and missing out on extracurricular activities due to doctor appointments, medical procedures, and pain crises. But family, friends, and community members can play an important role in positive health outcomes for students with sickle cell. And one way, as we have said over and over, is by giving blood. So please, as Dr. Miller said, roll up a sleeve to give blood, or as a community-based organization, a social and fraternal organization, or a faith-based organization, why not host a blood drive in your community? After all, we are all in this together. And to learn more or schedule an appointment to give blood, visit joinedbyblood.org, or as you heard, call 1-800-RED-CROSS. Thank you, blackdoctor.org and the Red Cross, for hosting this awesome discussion. All of you, thank you for joining us, audience. Take care and look out for the replay so you can bring your notepad and get some of the points that you may not have gotten the first time around. Take care. Bye-bye.